Well, such a unique initiative by ICMR at RIMS. I admire the scientific efforts made by each and every person of this country and particularly of RIMS. As we know that science is an integral part of medicine, barring the teaching and patient care. The three pillars of any good institute are established all over the globe, and RIMS is not devoid of any of these. Three pillars are medical research, the good academics, and the good clinical practices, so called as GCP. The RIMS is striving hard in order to achieve the third deficient pillar, and that is the research. And I am very happy that the efforts are continuously, ever since I joined, consistently are being made to enhance the research, and today's workshop is pertaining to the research methodology. My dear friends, let me reveal it here that no research can be fruitful, productive, creative until the medical ethics is followed. Ethics is something not new, though it has occurred, it has been propagated. The need was felt in recent past because of the unethical practices rampant amongst the scientists, medical scientists, and rest of the scientists throughout the globe, more in India. I was ashamed once in a meeting in Vienna because I was a co-investigator of international project on dangerous brain tumor, and this project was participated by 137 countries. The scientist who was trying to show the malpractices and unethical practices, out of 4 examples he cited, 3 were from India. You can understand the gravity of situation. That science is done, even the science did not remain devoid of malpractices in this country. That is the very unfortunate issue. And mind it, we are the originator of ethics. Because I have interest in reading the ancient treaties, commentaries, and the available Pali literature, Sanskrit literature by celebrated monks, Bhagavata, Vinay Pitak, Abhidhamma Pitak, and I know it, that the ethics was the prime thing in our country which was practiced vehemently. There was a list available with the Sangha during the time of Buddha as to which medicine you can prescribe and which you cannot if the adverse effect had already been documented. Our ethical practices were of high order. Even think about 2600 years back, we have a formulary. We have a protocol-based prescriptions. We have, of course, the science was not that much rampant and developed. But I came across the reference that 30 types of the classified drugs were available, and the protocol was available as to which drug can be prescribed and which should not. This is, I am talking during the period of Buddha. And Jivak Kumar Bhatta was the disciple and the physician of Lord Buddha. Leave aside, he was the physician of Bimsar and royal physician of Middle India also. King of Middle India, I am forgetting his name. So much so that once a monk operated on a patient for fistula of ano. Fistula ano? I mean, this name is not written, but I as a medical person can easily understand that probably the monk who has written the treaty is talking about the fistula of ano. And the fistula of ano did not heal. The surgery was done. The instruments were crude at that time. 111 types of the instruments were available. I have written it, you can see in the Google also. 111 types of the instruments were available and nearly 11 types of the surgeries were performed during the during the 6th and 7th century BC. I am talking about that period. So Buddha had a knowledge of Ayurvedic surgery also, and Buddha was requested to examine the patient. Buddha, following examining the patient, said, "O monk, O Bhante, before indulging into the surgery, you must understand as to what is important in the patient, what kind of instrument you can use and what kind of instrument you cannot use. In future, I think until you develop those skills, you should not indulge into the surgery." That is how the ethics of this country had been. So I have given you example of Buddha period, and this is all available in Pali literature, very well documented. And I have cited an example of modern medicine few years back when I was attending a meeting of investigators in Vienna. Without ethics, the science is meaningless. Neither it is constructive, nor it is creative, nor it is productive, nor it is fruitful. So the making of 11 patient 110 at all costs should be avoided. And making protocol, pro forma, collecting data, organizing data and analyzing the data without doing science and computer, this must never be indulged into. Because I know there was a time of APS during SGPGI, in SGPGI, and I was appearing from assistant professor to associate professor, and 3 or 4 associate professors were stopped because they did not have publication in the journals indexed in Index Medicus. During those days, it was the Index Medicus which was the main agency of recognition, where the journal is indexed. It was thought to be of quality. One of them was anesthetist Shivpri. I am taking the name of Shivpri because he too is an anesthetist, and I am reasonably sure he does not belong to that family. So 2 anesthetists made a point to publish 6-7 public papers in a month, and they could do it successfully, and everything was done on computer. Nothing was done either in any lab or on patient or in operation theatre or during surgery or during anesthesia or during induction or during post-op period. And to our surprise, nobody could stop them. They said, paper चाहिए तो ले लो paper. अब हम paper ही लिखेंगे. So what happened in that bargain? That they stopped going into operation theatre and they kept on sitting on computer, and one of them was very prominent. He is quite a respected man. I will obviously not take his name. And when he realized that for the sake of getting promotion, it is okay, but it could never fetch any laurel for him. Vis-a-vis another scientist, again from anesthesia, who developed the tracheostomy tube. He is known throughout the globe for his tracheostomy tube. He is from India. You must be knowing Dr. Suchi Lambes. Dr. Bhattacharya is nodding. He must be using in critical care unit. So this is the difference between ethical practice and unethical practice. Now it is you to choose whether you want to do ethical practices or you want to do unethical practices. Well, ethics you know, you follow ICMR guideline, Helsinki criteria were well known. Nazis started in 1931 malpractices. Other prisoners were also put to the forceful investigations without explaining harms of particular treatment, investigation modality, without consent probably. Yes, we had the concept of consent during the Buddha period. This I am just telling because it is of interest for you all. When Kumar Baksha, Jivak operated a patient, and mind it, when the world did not know enough neurosurgery, we have performed the neurosurgery in our country. This is also published in world literature, you can see in Google. One merchant visited to Kumar Baksha, Jivak. He had severe headache, which persisted for years together. He went into shelter of Jivak. Jivak thoroughly examined him. There was no CT scan, no X-ray, no intracranial tension measurement, no features of measuring vitals. Jivak Kumar Baksha just examined the patient and he said the disease lies in the brain. And so much so that he could decipher that this disease cannot be treated by medical treatment. Surgery would be required. Kumar Baksha, Jivak, I have been awarded by this title, fortunately. Jivak Kumar Baksha, so I had to read it. Because of brain surgery. So, Kumar Baksha examined him. The merchant said, I will accept your slavery for rest of my life if I am being cured by you. The Kumar Baksha said that the surgery would be required. He was a trained physician from Takshila or Nalanda. There is little controversy whether he was trained from Nalanda or Takshila because Nalanda came afterward. But leave aside that issue is a bit debatable. So he took the consent of his wife and he explained the preoperative course that for 6 months you will have to lie straight on the bed. For 6 months you will have to lie on one side and for 6 months you have to lie on another side following surgery. So consent was taken. During those days when surgery was performed, his family was invited within the theatre. Of course, not those formal operation theatres were available. And Jivaka took out 2 worms from the brain. I have tried to collect entire data and I have written a very good case report on it. So this concept of consent, pre-op care, intra-op care, post-op care was very much available. And Kumar Baksha examined him post-operatively. Of course, he did not ask to lie for 1.5 years on the bed. Within 6 weeks, he allowed to, get up, and wound was healed. Herbo-mineral preparations were applied. So, such is the country where we are born. And now, because of the uproarious malpractices, modernicity, competition, unhealthy competition for material gains, for scientific gains, we indulge into malpractices. What I wish to convey with all my best wishes that learn the methodology, please do not indulge into malpractices, be they social, be they scientific, be they medical, be they in any other walk of life. Thank you very much.